This video introduces a revolutionary new technology in treatment for hard-to-heal or chronic wounds. Examples of these are diabetic foot ulcers, venous leg ulcers, pressure sores, arterial ulcers, hypertrophic scars, and keloids. The new product is called the SoeWound. Wounds lasting for more than 3 weeks without signs of healing are considered chronic wounds. These result from poor blood circulation, bacterial infection, diabetes-related issues, or a weak immune system. Wounds are highly susceptible to bacterial infection, and a bacterial biofilm can form across the wound surface. Up to 90% of chronic wounds have bacterial biofilms. It is recognized that biofilms are the principal cause of wounds becoming chronic. Chronic wounds need oxygen to regenerate, and wound oxygenation is a key determinant of healing outcomes. Limitations in the ability of vasculature to deliver O2-rich blood to the wound tissue leads to hypoxia. 60% of chronic wounds are of ischemic origin, which means the blood cannot reach the wound site, and thus hypoxia is a problem in wound healing. Existing treatments have slowly improved over time, but there hasn't been a step change in technology for the treatment protocol in a long while. SoeWound, with the new technology, offers to revolutionize the treatment of chronic wounds by breaking down the bacterial biofilm and by increasing the tissue oxygenation. This allows for better and faster healing of these wounds and leads to a major improvement in quality of life for the patients. Initial patient trials are showing this to be the case, with some spectacular results. It is an amazing development for the ongoing treatment of chronic wounds for specialist doctors and their patients. Let me introduce Dr. Ihab Tadros. He is president of DCare Medical Canada and is an internationally renowned expert in regenerative medicine for limb salvage and for treating chronic wounds. Dr. Tadros is at the forefront of innovations and advances in wound healing. Dr. Tadros reports a number of recent patient studies where he has successfully used the SoeWound to treat a number of different chronic wounds, and we will briefly look at each of these. I will not read the details of each patient slide, as you can see these for yourselves. The patient study sheets will be available for download from the website, details of which are at the end of this video. Patient 1 is a 75-year-old diabetic male with a nasty case of gangrene in addition to the wound. After 15 days of using the SoeWound, the infection was gone and healing well underway. After 60 days, the wound is completely healed. Patient 2 is a 42-year-old female with an open venous ulcer, and after 4 years the infection was very serious. After 15 days the wound is clean, and after 30 days the infection has gone, and healing continues through 45 and 60 days to a good recovery. Patient 3 is a 71-year-old diabetic male whose Achilles tendon has been surgically removed due to gangrene. After 15 days is clean with most of the infection gone. After 30 days, healing is progressing well, and particularly important is the high saturation of tissue oxygenation. By 60 days, the wound is healed, and the patient is prepared for a skin graft. Patient 4 is a 42-year-old diabetic male whose big toe has been amputated, after which there was severe infection at the site of the amputee toe. After only 15 days, the wound is very clean and free of infection and 80% healed. Healing is complete after 60 days. Patient 5 is a 52-year-old diabetic female with a diabetic foot ulcer, also called a pressure ulcer. It has been unhealed for 3 years with bacterial infection and gangrene in the subcutaneous tissue. After 30 days, the infection and gangrene have gone, and healing is well underway, and is still proceeding well after 60 days. Considering the patient had this ulcer for 3 years, using the SoeWound for 30 days completely cleared the infection, which is amazing. Patient 6 is a 64-year-old diabetic male with a diabetic foot ulcer on the top of the foot. These ulcers are notoriously difficult to heal due to the continuous movement of the foot joints. After 30 days, the infection has completely gone and the wound is 90% healed. Treatment continues. Patient 7 is a 76-year-old male with a diabetic foot ulcer. After 25 days, the infection has gone and healing is well underway. Treatment continues and we are seeing improvements day by day. The healing is slow but progressing. We have just started treating patients 8 and 9, both of whom are male diabetics with post-COVID diabetic foot ulcers, both with gangrene infections. Results of these will be reported on our patients' results database in due course. If you are a wound care doctor, we want you to get involved in this project and use this new technology with your patients and see for yourself the improvements in the healing of their wounds. We will now explain how the new technology works, how to use the SoeWound product, and how you can participate. For the past 10 years, a UK company, SoeHealth Limited, founded and managed by a scientist, Neil Stentiford, have developed a new technology called activated oxygen by altering the structure of the oxygen molecules in the air. A product called SoeMac was developed to deliver the activated oxygen. There are a subset of oxygen molecules called ROS, or reactive oxygen species. These molecules have a higher energy state than the standard oxygen molecules and are more reactive. We are focused on 2 of these related molecules, called singlet oxygen and nitric oxide. These molecules work together in the body and have antibacterial properties, ideal for breaking down the bacterial biofilm on the surface of a chronic wound. They also assist with the delivery of oxygen around the body by aiding angiogenesis and vasodilation, which leads to an increase in the tissue oxygenation. Dr. Tadros first met Neil Stentiford in 2019, whilst he was researching the possibility of using reactive oxygen species to treat chronic wounds. At the time, Neil was working with respiratory sufferers, specifically COPD patients, and was planning a clinical trial in the UK, working with the local university and hospital, and members of the British Lung Foundation's community groups called Breathe Easy. That trial is ready to start, but is waiting for COVID clearance. SoeMac has been shown to be safe, with more than 10,000 devices being used around the world and no reported safety issues. Upon completion of the clinical trials, it will be registered as a medical device with the UK regulator. Feedback from many hundreds of users and small local studies indicate a variety of health benefits, including easier and deeper breathing, clearance of excess mucus, a better quality of sleep, and more energy. Users' health conditions are numerous and include respiratory diseases, chronic fatigue, age-related macular degeneration, neurological, chronic wound, viral, bacterial, and many others. These are all conditions that benefit from an increase in tissue oxygenation and the beneficial molecule nitric oxide. From that meeting, a partnership was formed between Dr. Tadros and Mr. Stentiford, and an adaptation of the SoeMac was planned and developed during 2020. This has resulted in the SoeWound product, designed specifically for treating chronic wounds. SoeWound is slightly larger than the original SoeMac, as it has an inbuilt air pump and outlet connector. A cannula is attached, and the activated oxygen can be directed and delivered to the site of the wound. It plugs into any mains electricity supply, with the 12-volt adapter and international plug-ins provided. Suggested usage is 3 hours at a time, with the cannula secured next to the wound, gently blowing the activated oxygen across the wound surface and beneath the bandage or dressing. After 3 hours, the SoeWound is switched off and allowed to cool down, as it will become gently warm during usage. After 3 hours off, it can be turned on again, and the process repeated. The SoeWound should be added to the treatment protocol as soon as possible. All other treatments should be continued. There is no time to lose. The bacterial infection of the wound should start to improve after 3 days usage, and after 10 days we would expect it to be predominantly resolved. It can be assessed using a swab and simple lab analysis, or by using a bacterial sensor such as that made by the company Omedics, or by visual inspection. The tissue oxygenation of the wound should start to improve immediately, and again can be assessed by the expert eye, as you will see the granulation tissues forming after 7 to 14 days. The tissue oxygenation can be measured using a probe, such as the tissue oximetry system made by the company Edwards. You have seen in this video the improvements in the wounds of the patients who have used the SoeWound. If you are a wound care doctor, we want you to get involved in this project and use this new technology with your own patients, and see for yourself the improvements in the healing of their wounds. The SoeWound has a list price of $750 US. As a special launch offer and participation in the trial with your own patients, you can purchase the SoeWound at half price, which is $375. Or you can buy 5 SoeWound for $325 each. Or you can buy 10 SoeWound for $300 each, by going to the website SoeWound.com and follow the instructions. Your SoeWound will be dispatched to you anywhere in the world, with free delivery cost. We ask that you then record information on the trials you conduct and share back with us in a similar one-page summary format to that shown by Dr. Tadros' patient studies earlier in this video presentation. A template is shown here, which will be emailed to you when you order your first SoeWound. By sharing your patient's pictures and improvements, you will then have access to all of the patient reports submitted from other specialist doctors from around the world. We will regularly update the database for all participants to review. Patient anonymity should be preserved at all times. Come and join us as we introduce this amazing new technology that will help thousands and one day millions of people around the world to live a better life.